Thank you for having me, and thanks everyone for being here. It's an amazing turnout today. I'll introduce myself physically. I am a white woman in middle age and have shoulder-length blonde-ish hair. I'm wearing a black jacket and a lime green top. And I am delighted to be here to talk with us all about participatory action in action involving the youth voice in knowledge translation through our online training project. I first want to thank NIDLR for all of the opportunities that they have given us. This work was funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. Though that does not mean that they necessarily endorse this work. So I'll tell you a little bit about myself and about our center. And you heard earlier from Robin Tasca, as Kathleen mentioned, and even saw Dee Logan, who is helping out in the chat. We're all from the Implementation Science and Practice Advances Research Center, or ISPARC, within the UMass Chan Medical School Department of Psychiatry and Behavioral Sciences. I work mostly within our Transitions to Adulthood Center for Research, which focuses on youth and young adults. I'm a rehabilitation counselor by trade. I heard CRCs are in attendance today, and have been in the field for a bit and for a long time in training. So I am excited to bring this to you. The work I'm going to be talking about today is really a part of our Learning and Working Rehabilitation Research and Training Center, or RTC, and that is an effort to improve supports for youth and young adults ages 14 to 30 who have serious mental health conditions as they complete their schooling, go into post-secondary education, and move into rewarding work lives. So we really do focus on learning and working. And we're grateful to be working now within our fourth RRTC that focuses on learning and working. This work was from our previous RRTC. All right, so I thought I would set the context a little bit for what is participatory action knowledge translation, and we'll start that out even by looking at what is participatory action research. Participatory action research may be something that people have heard more of than participatory action knowledge translation. I know that was true for me. And participatory action research really brings the people who are affected by the research into all aspects of the research, from thinking about what it should be, to the planning, to the designing, to the implementation, and to evaluation of that research. I think similar to kind of the integrated model that we heard about earlier. At the Transitions ACR, or Transitions Center, we recognize the importance of this. And we think it's really important because it increases the participant voice, or that end user voice, in the work. And the participant power. And I think this is really important because a lot of times research is happening sort of around people, or sort of really far away from people, or it might feel like it's happening to them, but not with them. And so it's important that we look at one, how to make the research accessible to the people that it affects the most and benefits the most. But also engaging them in being a part of that research. And the same is true for knowledge translation. So the aim of participatory action knowledge translation is reducing the know to do gap, or the research to action gap. And you heard earlier that it's 17 years, and that's my understanding too. It used to be 20, so I think we must be doing something a little bit right, reducing it already. But, the aim is to start to reduce the amount of time that it takes to get what we know to be helpful, good and right and true in the research to actual use to support and benefit the people who need it the most. And so this kind of knowledge translation then wants to bring in the people who would benefit from, the information that comes from research and really engage them in all parts of the knowledge translation. So some of the ways that we do that, and some of the components of participatory action knowledge translation are things like engaging stakeholders. So identifying, engaging like relevant community partners, who should be involved in this and how can we engage folks in this work of translating the knowledge that and the information that we've sort of gleaned from the research, co-creating the knowledge translation with those partners. Now, I'm going to be talking more about how we did this, but in this case, we were working with young adults with mental health conditions often, so that they could be involved with all stages of our knowledge translation. Tailoring the KT strategies so that they are, tailored to the people who will be receiving this. And I'll tell you some of the ways that we worked to do that. So it's important to, really look at what are the needs, what is the context, what are the priorities of the group that you are intending to benefit. And then also recognizing that it is an iterative process. And I know for us, it definitely was that, you go to the communities and talk with them about what they think this should be. And then after you've started to really play with that some, bring it back to that community and get some feedback and, have it be this sort of ongoing process where you're reflecting, you're thinking, you're making changes to it based on what you're hearing from the community that it benefits, and really trying to create something great with the people who will be using it, who will benefit from it. So this is the context for the work that we did is through participatory action knowledge translation. Now I'm going to be talking about how we did that through 2 free online courses. So let me tell you about that project. That was a part of our RRTC, the Learning and Working RRTC. And, we were wanting to create a training program that would meet the needs of folks who support, young adults and youth who were moving into their vocational lives. And so this included, service organizations, educators, employers, state agencies, etc., who served youth and young adults with serious mental health conditions. That is our kind of primary audience. And we wanted to also tie in the research findings that we had been gathering, I guess, in that RTC, but also the ones that came before it. So this was our goal entering into this. And I'm going to take this opportunity to thank some of the people who were part of this process. So you'll start to see some of the people who were involved with this process. Our young adult advisory board and our family advisory board both gave elemental input. There was a young adult who worked with us to, she was sort of elemental to this process of developing the resources that we would put into our courses, Emily Sudbrock, and our PIs, doctors Michelle Mullen and Marcia Ellison, supported this work. So I want to make sure to mention them. I'm just representing a team of folks who have done amazing work. So we ended up calling this the Promoting Young Adult Success in School and Work courses. This is a series of courses that are aimed at providers and other supporters of young adults with mental health conditions who are pursuing employment, education, careers. And by pursuing, I mean they might be thinking about it, kind of deciding where to go, getting into work and school, working on, staying there for as long as they wanted to stay there, or changing schools or changing employment, so that pursuing piece becomes a larger context. You'll see that we leveraged an easy to use learning management system, Moodle, to provide access. And on the left, there's a picture of I don't even know what you call it, but the box that you kind of click on in the course. I'm going to show you that in a little bit. That gives you entry into what has become our series of courses that was really guided by these youth and young adults and their supporters. In that picture is a younger and older man in a workshop, with the older man having his arm around the younger man, and they're laughing about something. Okay. So let me tell you a little bit more about what's in the courses. So these courses, just to give you a sense of what we ended up designing, what they are virtual, and completely virtual. They are participant led, which means that the instructor, and I'm the instructor, don't really touch it. So, it's not a week one, make sure you hand this in kind of course. It's a completely virtual set of courses. People self-register. They can hear about it from somebody and go in. I'll provide you with a QR code at the end and a link, so that if you're interested, you can go in. They're free. And so no cost. And they're accessible whenever, wherever, and however often a person wants to access the course. So our hope was to provide free and flexible access to people, so that they could really design the kind of course experience that they wanted. So people can go in and grab a resource or a set of resources that really meet their needs at that moment, or they can, go through the entire set of courses. There are two. And kind of go through it piece by piece and learn all of the elements. So it's super flexible. People can take it at their own pace. And no matter how much of the course they've taken, they can receive a certificate of participation. So we really wanted this to be low barrier and just helpful and useful to the folks who would be taking it. And our intention is that the folks who take it are generally providers and other supporters of people, young adults with mental health conditions. However, as you'll see in a moment, there's one course that's really meant to provide resources to be shared with young adults. So I'll show you that in a few. Here, though, is how we incorporated the end user, right? The person who would be, or persons who would be, most impacted by these courses. So we did this on a variety of levels. And this in and of itself was an iterative process. So the first thing we did was engage stakeholders who we thought would have, a stake in this and real interest in this. And that those first kind of communities that we reached out to were our young adult advisory board and family advisory boards. And went to them and said, help us think about what these courses should be and what kind of content we should provide to those who support young adults to be in work and school. And I'll give you an example. We were hearing things like everything. The Family Advisory Board was saying, please provide everything. Our young adults need a lot of support. And, there isn't a lot of kind of this kind of specialized support out there. So if you could provide a lot of different elements that young adults need to be thinking about. So we really carried that with us. And, we went back to the Young Adult Advisory Board, as it says in the fourth bullet around our iterative processes. We went back to them, and I remember one of the things that they said was make it inviting for young adults. If this material is going to be shared with young adults, if supporters are going to share the courses potentially with young adults, make the themes and the pictures and the colors all very inviting for youth and young adults. So they helped us to really think about that. So that was an exciting process for us. It really did guide how we started to think about these courses. Then we co-created the course with a young adult staff member who had lived experience and who was absolutely essential to creating the kinds of materials that we included in these courses for providers and supporters of young adults, and made sure, kind of, I'm a middle-aged white woman here, helped us to make sure that the information would be interesting, helpful, and engaging for young adults and their providers and supporters. Another thing that we did was hire an instructional designer who was also a young adult, who could really help us think about how to make the courses inviting, within the structure that we had. How can we make it the most inviting and the most interesting for young adults and their supporters? She also helped us make it accessible, self-registering, and self-directed, so that it was very easy for people to access. I don't really know what I would have done without her. And then, the last thing I'll mention is evaluation. So one of the elements of this participatory action process is to have young adults evaluate it. And so we worked with a young adult who had both experience of using services and of providing services to really test out and see, did they like what it looked like? Was it accessible? Was it usable? Was it helpful? Was it interesting? So we gathered information from at least one young adult to really see if we were on the right track along the way and before our launch. So let me show you a little bit about what we ended up doing with all of that help from youth and young adults. We created 2 courses, and the big idea is promoting success in work and school for young adults. And this first course was called Engaging Young Adults in Work and School. And I should mention that, like in each module of each of the courses, people are doing several things as they go. They are watching webinars or videos, other media like podcasts. They're reviewing written resources like tip sheets and comics and other things that might be a helpful way to kind of support young adults to think about and be in work and school as they develop their human capital, right? Their resumes, and kind of develop their careers. They might be listening to inspiring stories that were told by young adults, by providers, by researchers. So to really hear from others about like the impacts of this kind of work. And they could also post and discuss experiences with others. And this is what course 1 looks like, the content modules. There's 3 of those. There's always an introduction in the beginning, and at the end there is a survey that people can take in order to get their certificate of participation. But the course content modules have the kind of main content in there. And in the first course, since it's really focused on providers and how they might engage young adults in work and school. We started with, why is it important to do this? What does the research say about what are some of the realities for young adults with mental health conditions and work and school? Why is this so important? And really kind of get some buy-in from providers around the importance of it. The second module focused on strategies, and that included both resources and some kind of instruction around here's some things that you can do, kind of tips for success. And then the third module is on the programs that support engagement in work and school. And that really focused on some, really lovely examples of programs that are engaging young adults with mental health conditions in work and school now and are doing it really well. So that if providers are looking to start a program or are thinking about, could this even be worthwhile for us to hear from other folks who are doing it? And then the second course is work and school resources for young adults. And you can see there's parentheses around the U in young adults. And that's because we anticipate that this is young adult facing material that providers might share with young adults directly. They could even share the course itself, but that we really were searching for and providing young adult friendly resources. There are 3 modules here. One is on school, one is on work, and one is on career decision making. And there's an example to the right of what you might see in the course and starts with a module introduction. And then the work and school modules have 4 different elements, and within each element are a lot of resources and fun stuff to look at. But those elements are choosing where to go to school or work, getting into school or work, staying in school or work successfully, and then leaving school, so that providers had information and resources and content to bring back with them, no matter what a young adult might be doing. If they're thinking about it, if they're in it and trying to survive, if they are considering leaving and going to something else, that they would have resources to help them. So I'm going to show you now. All right, so here we are. Our LMS has at the top hypecareers.org. It really did start as part of our helping youth on the path to employment programs. And so there's information in there about that. If you scroll down, you'll see that picture that I showed in the beginning. And you can click right on it to get into our courses. If you're new to this, you'd register with Moodle and get in there. But let me show you an example of what this might look like. There's a welcome, and then there's some easy to click on kind of little boxes here that bounce when you hover over them. I'll go into the school one since we saw that a moment ago. And then you can go in and take a look at whatever pieces you're most interested in. And I'll show you what that looks like just kind of quickly. There's a little bit of an introduction about why would you look at staying in school successfully, for example. We know that a lot of students with mental health conditions struggle to stay in school. And so this is an important aspect. There's a little introduction video by me mostly. And then there are kind of topics with things that people can click on. So if they click on strategies and tools to finish the semester, for example, they get to a webinar that they can then listen to about some strategies that were recommended during COVID, but are still, they're recommended no matter what period we're in for staying in school. Here there's a piece by the JED Foundation on tips for managing academic stress in college, and they all open up in a different tab. And then below that are a number of tip sheets that get at different topics like getting accommodations at college and out-of-the-box college accommodations for students with mental health conditions. I'll click on this one, which is a fun one. This was developed by a young adult who worked with us. Can I bring my emotional support animal to college with me? So that's an important one. And people can learn about all of these different topics by clicking on these resources. They can print them out, they can download them. It's all free information. And then from there, they can go to the next page or go back to the module homepage. Okay, I'll stop sharing there. Um, so if you are interested in learning more about those courses, you can hover over the QR code there or click or type in hypecareers.org into your favorite browser. And if we have a couple minutes, I'm happy to take any questions that we see, Kathleen.
Perfect. Thank you so much. So we're getting a lot of sharing of links. Thank you, Robin, for joining in and pointing people to where these resources are.
Thank you, Robin. And I see yay to CRCs. I appreciate that and agree. This is great.
I was wondering, does this course itself offer CRCs?
No, not in particular because it doesn't, well, for a variety of reasons. But I'm happy to work with somebody on giving them a letter that they could submit to the CRCC, for example. So happy to work with folks on that if they're looking for some support.
Because I can tell you, it does boost participation, as you can.
Yeah. Yeah.
So it's not a bad idea to think about that.
Yeah,
And could you talk, just given the the dimension of the theme of the conference on measurement, like any kind of information you think you have or might be collecting on, use and adoption of the course?
Yeah. We've been sort of lightly measuring. So we've been looking at things like how many people, I think the last time I had looked, it was over 200 people had participated in the courses, which was delightful because, again, we don't really touch the course very much. So, people are finding their way there. We collect some demographic data it's very voluntary. If people want to give us that information, we do ask that people fill out the survey if they want a certificate of participation. And through that survey, we collect information like, simple demographics. And trying to think what else we collect in there, but very simple information. So we mostly look at, to what extent people have been entering the course and using the course. We can look further at how much of the course that they took. We're not at this time looking at how they implement the information, but that may be a future direction.
Sure.
Yeah.
I know that's why there's always such interest in that, because it is hard to do.
Exactly.
Well, thanks, Debbie.
Yeah, you're welcome. Thank you so much. And I'll try
There
to.
is one question, if it's a quick answer. How did you decide on Moodle versus another learning management system?
Oh, good question. Moodle is one that we had access to at UMass Chan. We also had Blackboard, but that wasn't as accessible and it wasn't as easy to use. So we went with Moodle because it was fairly easy to program. And I will say that when I first started, I was green around the edges with fear.
Well,
This
thank
was
you
not,
so much.
yeah, this is not an area I knew. I'll respond to everybody else online in the chat. Thanks for having me.